The vital role of yoga therapy in oncology care. This is from the ASCO Daily News, the critical news for the American Society of Clinical Oncology. This is printed August 24, 2023, authored by Lois Ramondetta, MD. Key points. Yoga is a mind-body practice that not only incorporates movement and stretching, but includes controlled breathing practices, relaxation, and meditation. Yoga therapy is a process of empowering individuals to progress towards improved health and well-being through the application of the teaching and practices of yoga. Clinical practice guidelines support the use of yoga practices to help patients with cancer manage fatigue and nausea and help improve overall quality of life. Yoga should be considered for reducing distress, depression, anxiety, sleep disturbances, cognitive dysfunction, pain, and menopausal symptoms. Many would say we've fallen short in supporting and treating the mind and spirit. And yet, here we tend to focus on pharmacological approaches for depression, anxiety, pain management, and more. The reason for medicine-based therapy is complex, but it is often more pragmatic and easier to prescribe than non-pharmacological psychosocial and or behavioral approaches. Yet the non-pharmacological approaches are often not even considered as options for patients. As many as 15 to 20% of patients with cancer are taking medication for anxiety or depression. And the widespread opioid epidemic has ravaged the rural and urban United States alike. For some, medications for anxiety, depression, and pain are the best approach. However, for others, the risk of toxicity far outweighs the benefits. Unfortunately, the factors that influence physicians in taking a more pharmacologic approach are not solely based in the evidence and include societal preference for a quick fix, using a pill, other than non-pharmacological approaches that often take more time. Furthermore, providers are often not educated on the evidence base supporting non-pharmacological approaches and may find a prescription easier than to provide other therapy, for example. Disappointingly, insurance coverage for non-pharmacological integrative medicine interventions are often frustratingly limited. Fortunately, as the evidence mounts for the benefit of integrative oncology techniques, so too do the guidelines for incorporating non-pharmacological approaches into clinical care. In the most recent ASCO guidelines for the management of depression and anxiety in patients with cancer, pharmacotherapy is not recommended as a first-line treatment, either alone or in combination. Instead, the focus is on cognitive behavior therapy, behavioral activation, mindfulness-based interventions, structured physical activity, or empirically supported psychosocial interventions. ASCO, in collaboration with the Society for Integrative Oncology, has also developed clinical guidelines for the use of integrative medicine in cancer care. One important evidence-based integrative approach can help in treating multiple symptoms from treatment is yoga, dispelling common misconceptions about yoga. People hear that yoga is a mind and body-based movement. Although there are many benefits to this type of mind-body practice, the foundation of yoga as therapy is based on a detailed intake assessment of body, energy, mind, intellect, and spirit of a client. Yoga therapy interventions, in contrast to a group yoga class, are based on a comprehensive individual assessment based on a whole body, mind, and spirit approach. And the tools recommended are derived from not just movement, but from a comprehensive yogic lifestyle approach. Per the International Association of Yoga Therapists, yoga therapy is a process of empowering individuals to progress towards improved health and well-being through the application and the teachings and practices of yoga. This approach to yoga as a lifestyle intervention spans from self-reflection on the way one interacts with the world, in the importance of self-care, and draws on specific practices focused on movement, breathing, sensory withdrawal, focus, concentration, meditation, and finding a sense of meaning and purpose. Examining the evidence base for yoga interventions focuses for future research. Even though the applications of yoga within oncology-based clinical trials has focused less on yoga as a lifestyle and more on a movement relaxation components, the evidence for the benefits of yoga in cancer care has resulted in yoga being included in the SIO, ASCO, and National Comprehensive Cancer Network guidelines for symptom management. Current SIO, ASCO guidelines recommend that yoga be considered for patients with cancer for reducing anxiety and depressive symptoms and improving quality of life, mood, fatigue, and sleep quality. The joint ASCO-SIO guidelines for the use of integrative medicine for pain management, published in 2022, included recommendations that yoga be considered for patients with breast cancer experiencing aromatase inhibitor related joint pain, for patients experiencing other pain, an effective treatment of cancer-related fatigue and nausea, and the patients should consider yoga for reducing symptoms of distress, improving cognitive functioning, reducing pain, and coping with menopausal symptoms. Despite the strong support for yoga in cancer care, it's difficult to determine the broader effects of yoga because of the challenging nature of this type of research. Individual biases and preconceived notions can influence outcomes, and as can other factors such as phrases used by the yoga teacher, the music chosen, the practices used, and the dose of exposure. Furthermore, tailoring yoga to each patient's abilities is challenging in the protocolized research context. The research on yoga is also limited because it's difficult to measure more subtle benefits of yoga, such as open-heartedness, feeling connected to others, being in touch with one's true self, feeling calm and serene, and experiencing positive transitions at the end of life. Although the subtle aspects of yoga are hard to measure, yoga researchers have documented the physiological changes associated with yoga. Extensive evidence exists for the effects of yoga at reducing sympathetic nervous system activity. And increasing parasympathetic tone, improving heart rate variability, and accessing ideal breath frequency. And the suppression of chronic stress response may play an important role in managing disease progression. Newer research suggests that yoga does not just influence the physiological tipping of the scale towards the parasympathetic vagal system, but also may result in increased level of gamma-aminobutyric acid, improved regulation of the dehydroprogesterone, melatonin, and hypothalamic pituitary adrenal axis pathways, and a reduction in inflammation. As the research continues to evolve, scientists will uncover yet undiscovered ways in which yoga therapy impacts mind, body, brain, and spirit. Concluding remarks. What is clear is that yoga, even in its most reduced form of stretching and relaxation, is a beneficial tool for supporting cancer survivors throughout the cancer journey. the percentage of cancer centers with certified yoga therapists on staff continues to expand. Unfortunately, access to yoga therapy is limited in most medical institutions. And even where there is access, yoga therapy is not covered by health insurance plans. Yoga therapists provide care that is unlike other therapies, in many ways transcending the boundaries of conventional medicine. We need cancer centers to hire certified yoga therapists, and at the same time, it's crucial for government and other health insurance plans to establish comprehensive coverage and develop unique, reimbursable, current procedural terminology for codes for yoga therapy. This will allow for the systematic provision of yoga therapy and allow patients with cancer to reap the myriad benefits that yoga therapy offers to society, enabling transformative improvements in both life and health.